Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hey Barbara, so tell me what happened to your back.
I picked up a quadriplegic in his wheelchair, electric wheelchair. He got his hand, his hands was bad, and he got his hand on the throttle and he couldn't get his hand off, and he was headed into a street with traffic. And I picked him and the wheelchair up and pivoted around and set him back up on the sidewalk. That was the first initial on my back.
So when did you injure your back? Like how many years ago?
This was in 1988.
1988, so it's about like 30 years or something like
Yes.
that. Okay.
Yes.
So briefly, what kind of treatment you had? How many surgeries you had for your back after that?
Just my lower back. I had surgery about 9 years ago.
So did they fuse it?
Yes.
Okay.
And put a plate in there.
Okay, so they put a plate in the lower back.
Yes.
Okay.
And in 91, I had the 3rd through the 5th.
The C-spine, okay.
Yes.
Fusion.
Fusion. And then 9 years ago, just prior to the lower back surgery, they did the 5th through the 7th.
Okay, so they fuse your neck and fuse your lower back.
Yes.
But because you have a lot of lower back pain, now we're going to focus on the lower back.
Okay.
Okay? So for the lower back, what kind of symptoms do you have in your legs and your back? What do you feel? What kind of pain? Is it sharp, dull, aching, numbness?
All of them, but not all at once. Right now, I have the tingling down the front of the legs and the pain, stabbing in the back.
In the back, just sitting
right now, just sitting here.
Yeah, so you have a constant pain. How much constant pain from 0 to 10?
When I can get it down to a 3, I can go to sleep.
Okay.
But the rest of the time during the day, she runs about a 5 or a 6.
5 and 6, constant pain, and
constant.
At worst, how much pain from 0 to 10?
Heavy 10.
Okay. So you said numbness and tingling in the front of your legs and stabbing pain in the back. What motion aggravates your symptoms?
Movement. Any movement.
Any movement.
Yeah.
So standing, sitting, walking, anything?
Anything.
Anything. Yeah. So how far can you walk? And do you use walker or you walk just without any assistive devices?
Without assistance, I can walk
10 feet.
Maybe 10 feet.
Yeah.
With a walker, I can double that.
Okay, so you have to use a walker because of your pain increase.
Yes.
Okay. So how much pain you feel right now?
About a 7.
7.
Heavy
okay.
7.
All right. And where do you feel the pain exactly?
And my hips. And is the
joint
pain
itself or just the back?
all the way across the back.
Across the back. Okay.
And then I've got the numbing, tingling, stabbing, little needles sensation down the front of the leg.
And the numbness and tingling, that happened before the surgery or after the surgery?
After the surgery, after they dropped me on the cement floor.
Oh, so you had accident after the surgery and you start to have those symptoms?
Yes.
Okay. So
psych herself up for standing up.
left side, so I can hold you here.
Okay, just a minute.
You okay?
Yeah.
Okay, so we're gonna take your time.
Okay.
Okay. You okay? Sorry.
Okay.
Do you know what?
What?
Don't worry. Just relax. You can relax. Relax. Sorry. Oh, you okay? Here you go. I got you. You know what? We'll do it sitting. Is that okay with you?
Okay.
Okay. When you're ready, you can sit here.
Okay.
You want to get you some water?
Oh, just give me a minute.
Take a deep breath. Okay. You can have a seat here. That's okay.
I'm trying to.
Yes. Comfortable like that?
Yeah, this will work.
Okay, so we'll do it sitting here, okay?
Okay.
9 years ago, okay.
Yeah.
How does it feel?
Weird.
Okay, as long as it's not pain, that's fine.
Yeah.
You're gonna feel pressure. It's okay to feel pressure.
Yeah.
As long as it's not increasing your pain level.
Okay.
Is that okay? The
Yeah.
pressure is okay?
Yeah.
Okay.
Pressure's okay.
So I'm actually releasing the tightness. There's a lot of tightness in the back.
Okay.
So I'm loosening up those tightness. Because
Okay.
this tightness, it feels like you're wearing a t-shirt 2 to 3 size too small. It's like squeezing everything underneath it.
Okay. Well, I am, when you push on it, I feel it in my hip on
What do
both
you
sides. Pressure.
Okay. Pressure is okay. You're gonna feel pressure, but I don't wanna cause more pain, okay?
Right.
So I can feel a lot of tightness here. So your pain's mostly likely in the sides or in the middle?
All the way across.
Oh, sorry. Okay?
Yeah.
Okay. All the way across. Okay. Let your shoulder relax. Continue thinking about the ice cream you make, not other ice cream in the store, okay?
Okay.
That sounds more delicious and without the heartburn and other stuff. That's not healthy.
No. And what they have feeding their cows, I don't want none of it.
Oh my goodness, yeah. Yeah.
We used oat milk with the coconut milk.
Coconut milk, yeah, that's awesome. Do you make your own coconut milk or you just buy it?
Just to buy it.
Yeah,
You know you can make any, it's healthier if you make it at home, and it's very easy actually. If you want to make the almond milk or coconut milk, if you have a blender.
Now,
Yeah.
she's made almond
It's
milk.
the
Where you're
chemical.
pushing up there is hitting right in here.
When I push here,
Yes.
okay, sorry.
No problem.
Yeah, I don't recommend any almond milk from the store because it's basically chemical concoction.
yeah, totally.
You know what I mean?
Yeah.
It's better to drink water and avoid it, or make the almond milk at home.
Yeah,
That's
it's
what we
really easy.
do. Yeah.
The coconut, I've done it with the dried shredded coconut before, but I usually just get canned coconut
Yeah.
milk that doesn't have anything
too much?
added to it.
No, it's okay.
Yeah, and we'll make sure there's nothing added.
Right.
And, of course, anything homemade is just cleaner.
Yep, always.
Physical therapy?
They sent me to physical therapy. They had me walk around the room.
Mm.
I walked a little way, sat down on the machine, walked a little way, sat down on another bench,
No
walked a
manual
little
work?
more.
They did not work on your back here?
No.
Wow, okay. Yeah, just exercises?
Yeah, that's what they wanted me to do, but it didn't work that way.
Well, exercise is not gonna break the adhesion, the tightness in the back. We have to
Yeah.
manually release that.
Yeah.
Well, exercise good for you after doing the release, not before, because you're not ready for it. But I want you to do exercises at home, even
Yeah.
when you sit down.
Yeah.
Sitting, ankle pumps and kicks and stuff like that.
Okay.
Make sure no one in the front of you so you don't kick them. And blame it on me.
You work
Okay. I like it hot, but I don't like to get burnt.
Oh, sorry. Okay.
Okay.
You okay there?
Yeah, I'm okay.
I thought I mentioned
You
it's gonna
did,
be cold.
you did,
Okay.
but like I was trying to tell you, when you touch it,
It's just the reflex.
Yes.
Okay, alright.
He warned you, but there's too much time in between and you weren't braced for it.
yeah.
Alright, so well, I will warn you closer to it now.
Yeah.
You feel this bump here? That's a scar tissue here.
Oh, okay.
Is it too much?
No, no,
Okay.
it's good.
Okay, and here. And in your pelvis where you have an issue, okay. Okay, gonna put the lotion now. It's coming.
Okay, yes,
That
it's
did
there.
not work. Just
Well, that's what I do with the shower head, with
Yeah.
the water. As soon
keep
as
jumping?
it touches, I jump like that.
Oh my goodness, make sure you have a stool or some kind of
Oh, I do. I
seats in
have a
the-
seat in the shower.
Yes, make sure.
Because I can't stand for a
Yeah.
full shower. I have to sit
Yeah,
down.
just for your safety, okay?
Yeah.
How does it feel?
That feels all right.
Okay. Okay.
Now that's putting pressure into my legs.
Okay, what about now?
Yeah, into the right leg.
Is that too much?
No.
Okay. we need to really work on your core big time. Okay, suck your stomach in, nice and tall. Make sure you breathe, okay? Breathe, breathe, breathe. Okay. A little easy for you to work on it. Okay. How's that feel?
Fine.
Okay.
I just feel you moving stuff. There's no pain, no sensation, no
That's
nothing.
good. That's good.
We're down to normal.
Yeah, well.
Except for the pain. When I have the pain, it drives the blood pressure up.
Yeah, that's typical, yeah. Usually patients feel better just seeing me, you know, I don't have to touch them. I'm just joking. How's that feel?
Fine.
See how deep I'm going there? It's
Uh-huh.
basically the whole 3 inches deep in.
That's the other concern for her, is if she were to get the tools herself to be able to do certain
She can
things
do a lot
to
of stuff.
continue.
All of these, she
And I-
can do it on herself.
Yeah, I told
But I
her
can't
that,
do the back.
You cannot do the back.
No.
Someone has to help you with the back. But all of this
I
in the
don't.
front,
and
you
you can do this area.
Yeah, I can do
Yeah.
my shoulders.
you
and
know, if
down
you
the
want
front.
privacy and you want to do it to yourself, you can do it, you know. It's a very thick scar tissue. Do you want to feel it or are you okay?
I'm fine,
Yeah.
because I'll be feeling
Ouch, that kind of smarted.
Is that too much?
No.
But
I was just surprised.
you feel how thick the scar tissue, hard the tissue.
Mhm.
It's not like soft like here.
Right.
It feels like
A rope.
a robe, like really very thick band.
Yeah.
a ridge.
Yes. And guess what? All of this gonna put the fascia anteriorly in the front. How's
Because
that?
it just continues
Mm-hmm.
cinching up tighter and
Yep,
tighter.
yep. If no one
Mhm.
did anyone work in here in this area?
Mm-mm.
It's prohibited, okay? Don't touch it.
Evidently.
Yeah, and unfortunately, it's a very common with any abdominal surgery patient gonna have referred pain in the back because the tightness in the front, it's pulling on the tissue in the back,
Mm-hmm.
and you start to have a lot of back pain.
So basically that's compounded on top of the
Of
wheelchair accident and being dropped and all of that kind of
And
stuff, it's all compounded.
You see the redness, you see how
Mhm.
much like very thick, this is very hard, the scar tissue here.
Mm-hmm.
You can actually see it's
You
not
can
as
see.
puckered as before you started.
Wanna work, is this the surgery here on this side or the other side?
This side.
Okay, no, just relax, relax.
Can I move?
Sure.
I'm glad you're going over there, so now I can move again.
Yeah, that's fine, you let me know anytime, okay?
Okay, I'm letting you know. This is it.
Okay, is it more comfortable to put a pillow underneath? This is not too bad compared to the one on the front.
Yeah.
You can,
It's probably
you
been so
can
long that
see
it's not
the dent
communicating.
of the scar tissue, you know?
Yeah. Yeah, that one's only been 9 years. The one in the front has been 50.
50 and has not been released, it's very thick.
Right,
Yeah.
but back
Mhm.
then, nobody even acknowledged that part of the body mattering, right? The fascia and everything.
Well, it's unfortunately it's kind of subject that's overlooked because when you look in medical school, there's not a lot you can do to it. So even if you learn about
Right.
what do you have to work on it, there is manual stuff that exists there, but studies not showing really a promising outcome from it.
Right.
So in the school, if there's nothing really out there, so just
Yeah.
we're not gonna spend much time on it.
That's why you went the direction you did.
Yeah. Okay,
That's better.
can you feel a difference?
Yes.
She's taking
that's
less
better.
time. Okay, let's. Can
Yeah.
you try to walk a little bit?
Okay.
Okay. How does that feel? You can have
That's
a seat
better.
in the chair.
Much
You
better.
can have a seat in the chair here. Okay, Barbara, what happened now? Just to tell me, what are you doing?
I am laying flat.
What did that mean to you?
For the first
You
3
can sit
years
up for me.
after my surgery,
Uh-huh.
I had to sleep in a recliner because I had to have my back arched.
Okay.
This is the first time in 9 years
First time in 9 years.
that I have laid flat.
Lay flat on your back.
Yes.
Okay. So,
With no neck pillow, no nothing, just flat.
okay, can you show me how you get up?
Yes.
Okay. And We have the footage when we try. The first day I could not help you to get on the table. We could not do that.
Couldn't get me
even.
up there.
We could not even do that. And I had to hold you to. We were basically stuck in that
Did you
position.
check that out?
Yeah.
Look at this.
Look at that. Yeah, it's beautiful. Yeah, I told you we're gonna
That's
dance after this
awesome.
video, okay?
Yes.
We do that with some patient, not all the patient, okay?
Your son-in-law is gonna be.
Yeah, look at this.
I'm
Yeah.
amazed. I'm
Let's get
blown
up
away.
again. Let's do it 5 times, you know? So that's good. And she's smiling. She's not. How's that feel?
That feels good.
So now you probably will be able to sleep on the bed now.
Yes.
You know, going back to bed normally. Yeah, that's beautiful. How that make you feel?
Awesome.
Yeah, fantastic. I'm
That
glad.
is fantastic.
Yeah.
That is awesome.
Yeah.
Laying flat,
Uh-huh.
I can actually sleep in a bed, not in a chair.
In a chair. So you've been sleeping in a chair for
And
9
recliner,
years?
yes, in a recliner for
Oh my
9 years.
gosh. And that will cause more issue because it's gonna cause more tightness.
Yeah, because I have to sleep like this.
Yeah. Wow.
But not now.
Yep.
Flat.
Beautiful. Awesome. Okay.
Flat.
Beautiful. We had one treatment on your back. I worked on you a couple of days ago.
Yes.
So can you give me an update now how you feel? We did not even start the second treatment by the way on the back. So we're gonna focus on the back. How you feel?
There's no pain.
No pain. So let's go back to you had that back pain for 30 years. You had fusion in your back.
And
And when you came here, I had to hold you actually
Yes.
to have you stand up.
Yes.
Is that correct?
That is correct.
And actually, we could not even do the treatment on the bed here, in the treatment bed, because it's
I
the
couldn't get
treatment
up there.
table. Yeah,
Yeah.
because you could not get on the treatment table.
Correct.
So what happened yesterday? What did you do?
Well, we came here and he worked on my shoulders and stuff.
Neck.
And neck and then my daughter and I went to the county fair,
Okay.
which I have not been to a county fair for 30 years.
30 years.
And I walked for 2 hours with my walker, but still upright walking for 2 hours.
For 2 hours. Before that, how far you used to walk? You used to
10
walk?
steps.
10 steps. So before the treatment, she used to walk 10 steps. Yesterday, actually 2 hours. That is awesome.
Yeah.
So did you feel any pain, or what did you feel?
Well, I just walking along and there was a irritation, but it really didn't register that there was no pain until I sat down in the walker because my legs was tired. And I sat down in the walker and my daughter started pushing me and there was no pain.
That's awesome.
Yeah.
I just want to touch base on something we did not record it after the treatment. So part of the treatment, I do the manual, and then I had to do nutrition function medicine with Barbara, and we found that you needed some vitamins and minerals. She has some deficiency, and that was slowing her healing process. And I start her on a supplement, vitamin and mineral based on her deficiency, and then the next day, it's like the feedback I heard from you, like every day she feels a little bit better. And that's part of it, that feeling better, with having more energy, because she had severe deficiency. So we met that deficiency, and before the treatment, what time you used to tell me like you were just done for the day, could not do it
10
anymore?
o'clock in the morning.
10 o'clock in the morning. Yesterday, what time you went to bed and you felt you have energy? What time you went to the fair yesterday?
We were there about 4 o'clock.
So 10 o'clock, she's done for the day before the treatment, before we start to do the nutrition.
Yeah.
And you were walking until 4 o'clock. That's fantastic. Yeah, that's awesome.
We got there at 4 and stayed till 9.
Oh my goodness,
Yes.
you are showing off.
Yes.
That is awesome.
She pushed me around. We stopped at a few places. My daughter pushed me around in the wheelchair for a while. And then we headed for the door, and I got up out the wheelchair and I walked, I don't know,
That's-
150 feet or more
That's nice.
out the door into the
And
truck.
you felt you have energy, you didn't, yeah,
Yes.
that's cool. So,
And I drove home.
Oh my gosh, she's a superwoman now. Yeah, are you gonna run a marathon after this? That's a good goal. Yeah, we can work on that. Yeah.
Yeah.
So that's a very good progress that you were done for your day, feeling tired and just not getting out of the house after 10 a.m. And
Right.
yesterday was 9 p.m. So it's almost like 11-hour extra.
Yeah.
And that's with working on the diet, the nutrition, the deficiency that she has, and we just one manual treatment. So we will have you stand up and walk because we have the video footage for the first time that was really challenging to watch.
Right.
So
Right.
let's stand up. Oh, look how fast she's doing. Okay, we're gonna do it 10 times. Look at that. Yeah, and we'll have her to dance for you guys.
I could probably go dancing.
Yeah, look at
Okay.
that.
Walk.
Walk, yeah, beautiful. Oh my goodness, look at this. She is walking very fast now. Wow.
Yeah.
Oh my
I'm trying to
gosh.
remember heel and toe.
Heel toe, we'll work on that a little bit, but this is really nice. Wow. Yeah,
That I could not do.
I will have the other footage next to this because the first time I actually was holding you to get on the table.
Yes.
Yeah,
And-
and sit to stand like a couple of times.
Yeah.
Yeah, how does that feel? Any pain, any discomfort? The
I
skin
got
is
a
beautiful,
little bit right here.
but just tightness, yeah?
Day before yesterday,
Yeah,
I could take 3 steps and hurt all the way down.
yeah. You were, yeah, it was affecting your function. Look at this. Nice.
Not
Let's
even
do
pushing
10.
up.
Okay, beautiful. You see, so some people will say, how you gain the strength very quickly after the manual stuff? The manual treatment release the tightness, and we have to do the nutrition, function
And
medicine
10.
evaluation to meet the deficiency. Awesome. One treatment
God's
in the
still
back, actually.
doing miracles.
Yeah. Awesome.
Yes, because this to me is a miracle. For 30 years, I got up this way.
So for 30 years.
For
you
30
literally-
years.
Yeah.
And I usually had to have help. And then I would jerk all the way up. And if I sat down, I spread my legs. And I'd have to reach back and grab something and kind of fall into the chair, which would instantly give me pain all the way down.
Yeah, I remember the first day touching your leg,
And then-
you were in a lot of pain. Look at this. I'm sure you're a very good dancer. We're gonna do that afterward.
Okay, I'm ready.
Yeah, awesome. Thank you so much. I'm glad you're feeling better.
Oh, so much better.
Yeah.
I'll tell you what, if whoever is watching this, if you're worried about the money, think about the years and the stuff that you go through, that you have tried for this and tried for that and tried for something else. We're talking 3 days here. This is my 3rd day.
Yeah.
And I am walking, setting, and just everything. So I don't care what he charges. It is worth it.
Okay.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.